I'm the president of MotecLife-UK. My name is Paul Frietta. I'm an orthopedic surgeon. I have been moved by the plight of patients in the developing world, in particular Ghana, who need a lot of help. And we know that health is wealth. If we can't get a nation to be healthy, I think that it would mean that production could go up in some way. And also, being in the Western world, having lived here for over 20 years, I have actually noticed that the world is as strong as the weakest country. And people are moving out of poor countries to get to better economies, for better health care, and to survive well. And of course, if we're able to improve the health services in countries like Ghana, I think it will go a long way in helping the world develop the global health that we've spoken about for so many years. Motec actually stands for Movement of Personnel into the developing world to promote education, technology, transfer of skills, counting on the capabilities that membership have, and we indeed welcome all members of the public and the world to join us in trying to drive for health improvement. We believe, I in particular do believe that our job is not actually to take over the healthcare of any country, but if we can actually express our experience on the field, working with the local population, health workers, and they can pick some from us. And of course, we would also achieve some form of target and learn a bit about the tropical diseases that afflict the people in Ghana. I'm sure we all know that the ethnic minority in the Western world also have to be treated for these conditions. And so we get experience from our work to come back and help the people in the Western world. So Motec, it's essentially an organization trying to demonstrate what can be done in a country like Ghana to motivate them to improve the care through examples. And my appeal to all is that you can join this noble cause to make the world a better place. Thank you.
Or actually early 2006, I'm an orthopaedic nurse at Spire Hospital, Harpenden, and one of the surgeons there told me of what the work that Paul was planning to do. So we had a few meetings at the beginning of 2006 to prepare for our first trip in October. Our initial aim was to look at the services at one particular hospital, which is St Joseph's, where Paul had been asked to go and see if he could help them. After the first trip, we realised that predominantly what we needed to do was to set up educational programmes. Initially we looked at theatre staff, and then slowly over the year we started to include ward staff, physiotherapy, occupational therapy, pathology services, and a whole range of services that the hospital would encompass. I think after the first year, Paul then started to develop orthopaedic training programs for medical staff. And really after the first year, whenever we went to Ghana, everyone started to know about Motec. We were asked by more and more hospitals to look at what we were doing. We then went on to look at trauma services, which we were asked to predominantly by the medical director of the Volta region, because his concerns were of the high incidence of mortality at road accidents. Last year, because of this initial request from him, we started to set about a paramedic program, training program, which we put together October 2008, which was an absolutely fantastic training program for all primary paramedic services within Ghana, and this I know is developing again to this year. Hopefully later on this year there'll be a second anniversary of the paramedic services. I think one of the main issues that Motec has is to provide continuing education, to develop services and to support services that are already in situ within these hospitals. And one of our aims is not to go in to do the work for the people within the hospital, but to make them aware of how they can improve their own services for their own population. I know my personal interest with Motec is on an educational basis. I do enjoy the educational side of it, and I know that Paul has been approached to go further afield out of Ghana, and hopefully I will be going forward to India to look at services that's still attached to the same church as the one in Ghana, to see what services we can offer out there.
Hello, my name is Gladys Oforiata. I work with West Hertfordshire NHS Trust, and I'm based in St. Albans City Hospital. I've been a Motec member since 2006. I am a membership secretary. Since Motec was formed, I've been to Ghana on a number of occasions, maybe 4 times so far. In my opinion, I think it's a very good organization in the sense that we do help the needs in Ghana, especially those having orthopedic problems such as hips, knees, and those who are involved in road traffic accidents with fractures. Some of the problems we face while in Ghana is mostly transportation, even though the various hospitals that we visit do provide us with vehicle. I think as a charity organization living in UK and doing a great job in Ghana, I think we do sometimes put a lot of pressure on these hospitals to reduce the stress on these host hospitals. It will be ideal if we are lucky in future to appeal to some benevolent societies to provide us with transportation to be able to convey the Motec members to our various stations. What I also like to stress on is Motec being a multicultural group. I think it will also be ideal for our non-Ghanaians to know some of our difficulties that we face while in Ghana, such as water situation. Sometimes some of the hospitals that we go, with the electricity problem, lights go off, and then they're in the darkness, water is not running, and that causes a great deal of problem as well. Overall, I would say Motec has been doing a great job. People, visiting members that goes to Ghana do enjoy it. They appreciate the needs of the various hospitals. I think we're doing a very great job.
Have been a member since for the past 1.5 years to 2. I've been to Ghana with Motec Group on 4 different occasions, and currently I'm going to be going to Ghana with the group again in about a week's time. Now, the activities we do in Ghana is we have some selected hospitals or targeted hospitals, and we go there. Myself being a microbiologist, my task within the group is to help improve the laboratory services within the targeted hospitals. It's a big challenge, as equipment and materials are very limited in most of the hospitals that I've visited, but we're doing our best to sort of help with the little resources that we have to be able to help improve practices and to help towards good diagnosis of patients, because I believe that me being a microbiologist, diagnosis of infectious disease is very, very important. You know, once you are able to diagnose and capture the infections, correct antibiotic treatment is sort of administered, and it doesn't spread to making people get resistant sort of bacterial infections. Challenges are very, very high in that, as I've already mentioned, resources are very, very limited, and we occasionally do fundraising activities to raise funds to be able to send equipment that people have donated to Ghana, and then when it gets to Ghana, also we have to mobilize resources to be able to transport them to the targeted hospitals. Financially, we are not very sound, and we will need the support of well-meaning people, philanthropists, or anybody who will be able to help us to achieve the objective of helping to develop, to deliver a better health service to the people of Ghana. I'm a treasurer in the organization, and being a treasurer, I know that our accounts are not very safe. Wish all well-meaning people, we encourage all well-meaning people to sort of come to our aid, as I've already said, and hopefully we'll be able to make a real impact. We can't do all, but we'll be able to make a real impact in helping to improve the health service in a targeted hospital and Ghana in a whole. Thank you.
Okay, hello, my name is Sarah Daniels. I'm a doctor by profession, specializing in pharmaceutical medicine and drug safety. I first heard about Motec from an ex-colleague of, an old classmate of mine, Dr. Christina Machi, who told me about Motec, and I came along to one of the meetings and decided to join up. I think Motec is doing a fantastic job. I really take my hat off to the organisers, the president and the vice president. I think they really are doing something special. I had the good fortune to go on a Motec visit in April of this year, 2009. Visited 2 hospitals, Akosombo and Nkoko, to talk about drug safety and collecting adverse events, pharmacovigilance. Was very, very well received. I think there's a lot that healthcare professionals and allied professionals can do in Ghana with Motec, and Motec is giving us the structure to be able to do it. Sometimes it seems like what we're doing is very little, but believe me, it goes a very long way. I'm delighted to be part of Motec and look forward to being able to do much more in the coming years. It's a fantastic opportunity to be able to take back some of the things that I and others have learnt in our time outside of Ghana, and to be able to take it back into Ghana. And what can I say, anybody who's interested should join up. It's one of the most rewarding things I've done. And as I said before, I'm looking forward to doing more.
My name is Patty Edwards. I'm a reporting radiographer working at West Herts Hospitals. I first heard of Ghana through some other colleagues who told me what a wonderful place it was, and I thought, what a great idea for a working holiday. And that's exactly what I've had. I've had 2 working holidays in Ghana. The organisation has been donated 2 CR mobile image intensifiers, which have gone out to Ghana, and I went out in order to train the local people in how to use them. I've had 2 fantastic weeks, in fact 3 weeks I've had there, mainly in Nkoko and Akosombo, but I've also visited many of the other hospitals, seen things that I would never have seen in my working life otherwise. There's a lot to be done in Ghana. And hopefully Motec will make a difference. I found the radiographers in Ghana to be highly qualified, very motivated and exceptional. to tell you the honest truth. They are limited by the equipment that they have. Most departments are served by a single X-ray tube, which is floor mounted and has very little versatility. Trauma patients are having to move themselves from either a wheelchair or a trolley over onto the X-ray table. There's no facility for easing the pain of the patient in the X-ray room, and certain X-rays are very difficult to obtain. Ceiling mounted tubes would be ideal, but of course you have to have the structure to be able to accommodate that. Most of the developing is done with wet tanks. You dip the films into the developer and then the wash and then the fix, which is a highly messy and smelly procedure, and I ended up with eczema on my fingers as a result of that, and as a result I decided that I would try and concentrate my efforts on getting an automatic processor for one of the hospitals, which I've now acquired, and I feel very pleased about that. So that will be shipped out in October or September time. I think many more of these tabletop processors could be well used out there, but again, it's a matter of fundraising and finding places that might have a second-hand one that could be used. People locally have been very good at donating things. The 2 C-arm mobile image intensifiers have been used in the trauma centre at Nkoko, which is halfway between the 2 main cities in Ghana. The experience of going to Ghana has been a two-way thing. I would like to feel that Ghana, the people in Ghana, could tell us what they want rather than imposing what we want upon them. So an idea of what the syllabus would be for the student nurses at Nkoko, or maybe areas that are deficient, if they could tell us what they would like us to tell them, what they would like to be informed about. My forte is in interpretation of X-rays. Whether that's an area that is lacking, I haven't actually quite discovered that yet, but time will tell. And until I am told otherwise, I'll just keep plugging away, and hopefully some good does come of my visits.
My name is Dr. Christine Amachi. I'm an associate specialist in anaesthesia at the QE2 Hospital in East Hertfordshire. I joined Motec in 2 years ago. I got to hear from them through a friend of mine I worked with in the theatre, in the orthopaedic theatre at the QE2. She was raising money for a charity, and it happened to be money that she was going to give to MotecLife-UK. And when the president arrived at the gathering, he was Mr. Oforiata, who I'd been to medical school with in Ghana many years ago. Obviously, having thought about doing some voluntary work in Ghana for a long time, when my children were young, this was a special opportunity to make myself known to him and also to become part of Motec Life. I have been to Ghana 3 times so far in the last 2 years, and it has been a wonderful experience. I say that because Ghana gave me so much where my medical training is concerned. I've spent a long time in the UK, and I thought it was about time that I gave something back to Ghana. I gained all the experience in the UK, and it was not difficult to take time out to go and impart some of that experience and knowledge to people that would be happy to receive it. At the same time, I was also learning something from them. That's why I started my medicine. They practice medicine in a different way, and it was a give and take situation where they taught me things that I left behind a long time ago, and I taught them things that would improve and give them more scope to use what they already had to perform better in their professions. My recommendations for Motec: I hope that the membership numbers will increase and the sponsorship will increase. It's a very noble cause. There's a lot that can be done in Ghana, and there's a lot that can be taught. The opportunities are not there, and we are the ones to take the opportunities back, and we have a lot to offer. So I therefore think that Motec, in doing so, will impart knowledge and also increase the membership in Ghana itself, with sponsorship from here and from other countries, and also with membership from here and other countries, I hope that a lot of things will improve, and also the dealings between the two countries will also afford teaching opportunities and maybe sponsored courses for doctors and medical staff in Ghana to come to the UK and to other countries to better themselves and take the services back to Ghana.
Ghana is a very poor country, and we should remember that we are not actually going to work in a rich country. It also is not going to be like a Western. It's better than far. And the currency is a Ghana cedi. Now it's about £1 to 2.2 Ghana cedi. The economy, as the man would say, handshaking is really for if you meet a public that people want to do, you should shake from the right side to the left. Shake from the left. They will know you are. They won't worry about this. And that's down to reality. That's village life. The patient that you might be seeing may come from here, so if the patient hasn't got the right attitude, you understand. This is not English.
When you say the right attitude, what do you mean?
You might think that the person is not civilized. The person is giving, they have their own reacting according to their origins. Okay, so this is not actually England. This is actually on the Coral Mountain. And I think 2 members will be having a weekend break there this time. This will not organize. Things that you need to know, fresh fruits are recommended. And I think this time we'll try and make sure the cooks keep fruits in the fridge, because we need to keep maybe 20 young cities and it will be filled up for us. Discuss with the cooks what they want to eat ahead of time. The variety, it's not actually too bad. You might think, maybe they can cook also things that you get it as well.
Can I just also
Yes.
say something? Because with regard to the food, I think that what I noticed was that they tried very hard to give us what they thought was things like actually really enjoyed it when we started. That's when we really started.
improving on patient experience. So on my first trip, I did a lecture on expert patient, that is about getting patients involved in their care and they being the lead in a way. And then also I did some work on wound care, because I thought that if I compare the kind of way we were treating our wounds to the time I came in here, I saw a big difference. And so I went back to Ghana, looked at what they were doing, and told them what we are doing, in a way to sort of sensitize them to have a second look at what they're doing and see where they could improve. And I think that on the whole, I was happy because people were really interested and wanted to know more. And so this year, my project is to go back to what I did last year and see what kind of improvement have gone on. And secondly, I was touched by something I saw when I went last year. I worked with the public health nurses, and I saw the sort of work they were doing. They were doing really well. They had moved on since I left them, and I was really impressed. But I was touched in the way the setup of their clinic in the villages were. I saw them use a bench as an examination table. So my objective, one of my objectives this year, is to raise funds to help them have something better for the pregnant woman, especially for health and safety purposes. And so I would say that anybody, whatever your field, whatever you have, you don't necessarily need to be a health professional. You could go back to Ghana through Motec and see where you could make a difference. And no matter how little it is, it will go a long way to make a patient have a better experience. Thank you.